Welcome back to the Determinants of Health, students. Today, we're going to talk about disability. There are lots of ways to think about disability, and maybe you think you know what it is, and maybe you've used the word frivolously and without discipline, but we're going to solve that problem today and go through some of the theoretical frameworks that help us define what disability is. So let's start with this guy. Recognize this this awful, ugly, strange-looking, and perplexed human being? That's me. That is your professor, and he's a strange-looking man indeed. Mostly because this is New Year's Eve a couple of years ago, and he's probably had a few too many drinks. But most importantly, he's wearing glasses. Is he impaired? Is he handicapped? Clearly, he can't see well without these glasses. And maybe he can't see well because he's had a few too many drinks. Maybe he's just in a foul mood. We can't tell. But the important question I'm asking you is about the glasses. Is he a disabled individual because he can't see without the accommodation offered by his glasses? Put that in the back of your mind, right? Because I'm pretty sure that most of you listening to my voice right now probably have some kind of accoutrement or accommodation that accounts for a limitation in your physiology, like glasses. Now, does that mean that you're disabled? Why do we care about this question? Why do we care about how we define disability or whether or not we determine if someone is disabled? A lot of reasons. So, if we can acknowledge that someone is having a limitation in their activity, then that allows us to identify appropriate responses, maybe through medical intervention, maybe through institutional or administrative intervention. If we can define a disability, it allows us to categorize it medically, because that's what we like to do as scientists. We like to put things in categories. But I'm not being entirely facetious. If you are behaving in an unusual way, and I can recognize that as something belonging to a category of mental illness, yes, there are some stigmatizing effects, but it also allows me to approach your condition with a bit more clarity and perhaps more effectively. If we can define a disability, then maybe it allows us to divert resources accordingly. Oftentimes, we can't, as a society, spend money on a thing until we know what that thing is. Until I know that your behavior is part of the medical domain, I can't really allocate budgetary resources in the medical budget towards your situation. It's a failing of our modern bureaucratic society, but that's the way the world works. And also, if we can define something as a disability, then we can develop policies for accommodation. Think about the school that you attend. Right? So many people have a disability acknowledged by the university that allows accommodation for your exams, for example. So some people are given extra time for their exams, or extra large print, or maybe a quiet room because of whatever activity limitation they're experiencing. That would not be possible, probably, if we couldn't define the condition and the fact that this individual is disabled. And of course, the big downside is once we put a label on something, that often leads to marginalization and stigma, which is the ongoing uphill battle when it comes to issues of disability. So, we're going to talk about three aspects of the conversation around disability. This thing called impairment, this thing that we call disability, or more modernly, activity limitation, and this thing that we used to call handicap, but we like to call participation limitation. And I will suggest to you that these are distinct conditions. We tend to use the term disability in a colloquial fashion to describe all three of these experiences, but from a strictly scholastic health sciences perspective, these are distinct concepts. So let's start with impairment. Impairment is any loss or abnormality of psychological, physiological, or anatomical structure or function. Now, this quote comes from a WHO publication, which I will refer to several times in this presentation. But think about that definition. It's talking about deviation from normal body function, normal organ function, normal physiological function. This can be visible or invisible. Things that are visible are things, of course, that we can see in others, like their body parts not moving appropriately. Things that are invisible could be things that are psychological, for example. Right? So a hearing impairment would be an impairment. It's right there in the word. So something around the individual's ear physiology is not functioning appropriately. A visual impairment is an impairment. So something around the eye physiology is not behaving normally, and that's affecting one's ability to see. Or a movement impairment. So there's something around the hip joint or the knee joint or something in your legs that are preventing you from walking in a way that we would consider to be normal. Now sometimes we have tests to determine if you have these impairments. We have screening tests for hearing loss. We have visual tests for vision loss. And we have other kinds of sort of diagnostic visual tests to see if you're moving appropriately and so forth. Right? The way to think about impairment is that it refers to the function of a body part. It's very biomechanical. It's very much seated in the biomedical domain. We're dealing strictly here with the science of the human physiology. Now, disability is actually a limitation in the activity that derives from an impairment. So it is any restriction or lack of ability to perform an activity in the manner or within the range considered normal for a human being. Right there you see there's some qualities that we need to address. What is normal for a human being? Well, that's an opinion. Right? There's some people who see better than 20/20, for example. Are they abnormal? It's hard to say. So what we consider to be normal is going to evolve over time, and it is debatable. So you are disabled if your activity potential has deviated from what we consider to be normal. So maybe you can't hear or see well. Now, that's different from having a visual or hearing impairment, right? So your hearing can be impaired, meaning that the physiology of your ear or the parts that make up your hearing apparatus are not functioning appropriately. But if that leads to an inability to actually do the task of hearing, or of hearing voices and things like that, things that we can actually define in our environment, that's when it becomes a disability. If your hip joint does not function properly, that's an impairment. But if that leads to walking with a limp, that's a disability. We can correct disabilities, right? If you're visually disabled, then you can wear glasses. And now suddenly you're not disabled anymore, according to this definition. So that goes back to my first slide, showing the ugly face of that possibly drunken professor who was wearing glasses. The glasses corrected for his poor eyesight. So he's not disabled because suddenly his activity has not been limited by his impaired vision. Technology has prevented that limitation. So with impairment, we were talking about the function of a body part or an organ. With disability, we're talking about the function of the individual, of a human being who's doing an activity. That's the distinction. Impairment talks about the biomechanics of a part of the human body. Disability talks about the function of the entire human being that's doing an activity in the real world. And that leads us to handicap, which we prefer to call participation limitation these days. Handicap has a negative connotation. I'll still use that word in this presentation, but recognize that we are gravitating towards calling it limited participation instead. So a handicap is a disadvantage for a given individual resulting from the impairment, and therefore disability, that limits or prevents the fulfillment of a role that is normal. And again, what is normal? Normal is going to vary depending upon your age, your sex, a lot of cultural factors. So normal is going to vary from region to region, from culture to culture, from era to era. So participation is seated in a social context. So maybe the visual or hearing impairment that led to your inability to hear and speak is now making you unable to communicate with others. It is now preventing you from being a social animal. Maybe now you need help from people to be able to walk. Remember, the impairment was something about your hip joint. The disability was the inability to walk well. The handicap is the inability to walk without some kind of help or intervention. We can accommodate handicaps and participation limitation. We can accommodate them through things like ramps for your wheelchair. So think about the classrooms in which your classes take place. How many of them are accessible to wheelchairs? If they are not accessible, then the ability of disabled people to participate is limited, and therefore they are truly handicapped. If the environment is accommodating for their limitations, then their participation is not being limited, and therefore they're not handicapped. Participation is in a social context. So remember, impairment talked about the biomechanics of a body part. Disability talked about the function of a human being doing an action. And a handicap puts all of that in a social environment or context. So handicap is probably the concept that is most dependent upon culture and region and the vicissitudes of human definition. So, this is an important takeaway message. Disability is not an inevitable outcome resulting from the physical condition, the impairment, but rather it's the product of society and environment. You're handicapped or disabled if we tell you you are. Kind of eerie, isn't it? Okay, let's work through some examples here. So we're going to look through examples of impairment, disability, and handicap through 5 domains: speech, hearing, vision, movement, and cognition. So let's start with speech. So let's say the impairment that you are experiencing in the speech domain is you're having difficulty pronouncing certain words, though it probably has to do with your tongue being too big for your mouth, or some numbness in your tongue, or something like that. Okay? So maybe that leads to an inability to speak clearly enough to be understood. That's a disability. The activity of speaking is being impaired. The handicap is you can't communicate with other people. Your participation in human interaction has been limited. In the hearing domain, maybe you have a cochlear dysfunction. That's the biomechanical impairment that your body is experiencing. The disability is you can't understand when others speak. Therefore, the handicap, once again, is an inability to participate in human communication in a social context. Let's talk about vision. So maybe you have problems focusing on near objects. You're farsighted. So what does that mean? It means that you are probably limited in your ability to recognize common shapes, unless you're wearing glasses. If you're wearing glasses that correct for this, you're not disabled anymore. But if you aren't wearing glasses and you can't recognize common shapes, you can't tell your physical orientation in space. You can't get around anymore. You can't drive, you can't get to work, you can't meet your friends. Your ability to participate in regular human social interaction has been limited. In the movement domain, maybe you have an inner ear dysfunction, so you can't balance well. That's very biological. So your activity limitation would be difficulty in walking, and your handicap would therefore be the inability to move independently. You need help. So once again, you can't get to work unless someone helps you. You can't participate in regular social interactions. Now let's move on to the cognition domain. We're into the world now of mental illness, of mental disability. So your impairment might be brain trauma. Maybe you've got a concussion, or you're in a car accident and your brain got injured in some way. That's the physical aspect of your impairment. The disability is going to be maybe it changes your behavior. So maybe you get angry, or you're impatient, or you can't concentrate. So aspects of your individual behavior have been limited. The handicap would be your inability now to engage in regular social discourse. If you're angry all the time, or you can't focus, suddenly you can't maintain relationships. You can't have regular conversations with people. That's the handicap. Okay, are we clear now? So impairment is all about the biomechanics. Disability is about the inability of the human animal to do tasks. And handicap is about the human animal's ability to interact with his or her social and environmental context. So in an earlier lecture, we talked about the triad of health. Remember this? We had illness, sickness, and disease. We said that illness was the experience. Sickness was the experience within a social context, and disease was when all of that gets contextualized in the biomechanical sciences of medicine. So if you've got the sniffles, well, that's your illness. I'm experiencing some fluidity in my sinuses. I'm ill. Someone says to me, hey, you should go see a doctor because you're sneezing and you're making me uncomfortable at work. Now I'm sick. I go to the doctor and the doctor tells me I've got the flu. Well, that's a disease. That was a triad of health. Let's see how the triad of health maps onto our ideas of impairment, disability, and handicap. So I'll suggest to you it maps this way. Impairment, remember, is about physiological function. It's biomechanical. It maps well onto the disease domain from the triad of health, because disease is about, again, the formal biomechanical aspects of medicine. It's what we diagnose, it's what we treat. It's where we intervene scientifically. Disability is about the human animal's activities and whether or not he or she is being limited from performing those activities. That's very much an experiential thing. So that maps onto the illness domain, the patient's experience. And handicap has that social dimension attached to it. Handicap is about the extent to which one's disability prevents interaction with other people. Well, that's sickness, isn't it? Sickness is when your social environment tells you that maybe something is wrong with you. It's not a perfect mapping, but it gives us an idea of how we like to think about disease progression in general. There's the individual response, the social response, and the biomedical response. I mentioned in passing invisible disabilities, but they're pretty important to think about. So, an invisible disability is also a hidden disability, and it is, quite logically, a disability that's not immediately apparent. You have to either dig for it, or you have to ask someone about it, or they have to tell you about it, or maybe it's impossible to see entirely. So for example, maybe people with hearing loss don't wear their hearing aid in a noticeable way, so you can't tell right away that they have a hearing impairment. So we would count them as being invisibly disabled. Maybe there are people with joint problems or really bad pain. Then some days it's not so bad, so they can move about without using their canes or their walkers. But other days they do. So on the days where they're not using their canes, or maybe they're sitting down, you can't tell that they're having issues. And of course, mental disabilities are entirely unnoticeable in most cases. So it's important to remember that although these disabilities are challenging for the people who are experiencing them, it's difficult for other people to realize that there's something going on. And this creates a further psychological burden for such people to endure. It creates problems when developing policy to help these individuals through accommodation, because often we have to convince policymakers that it's real. People like the evidence of their own eyes. So let's talk about the types of disability that are common both globally and in Canada. In Canada, we have almost 4 million people who would self-identify as having some kind of disability, and that's about 14% of our population. Globally, the numbers tend to vary. So by one estimate, there are about 400 million people of working age that have some kind of disability. Other people say that we have about 1 billion people worldwide that have disability. That's probably more accurate because the working age doesn't include the elderly. So a very large proportion of the human race we would consider to be disabled in some fashion, 15% of the human population. But this chart shows us the distribution of people who claim to be disabled in Canada. And we see here that most disabled people in Canada claim to have a pain-based disability, right? Or flexibility, mobility disability. Think about that for a second. Who are these people? Well, they're probably older people. As we age, we tend to have more pain and more mobility issues. Interestingly, mental and psychological disability is the next most common. And that's gaining a little more play in the media, luckily, and hopefully we'll have more resources for addressing mental disabilities in the coming years. Disability rates in Canada are rising. Why do you think that is? Well, I'll suggest to you that there are probably several reasons. One of them is data collection. So, I just showed you a chart of the kinds of disabilities people claim to have, but if you have a disability, you may not even want to acknowledge it to yourself or to strangers on the phone who are collecting these data. So we might have an underestimate of the extent to which disability is affecting people because they don't want to share their medical states with pollsters over the phone. Maybe definitions are changing. We see this a lot in other epidemiological fields. So as we create more categories for disability, impairment, and handicap, then the numbers we have in each category are going to shift as well. But probably the most important characteristic that is affecting the rates of disability in this country is the fact that we have an aging population. So when we say aging population in demographics, we don't necessarily mean that our lifespans are getting longer, even though they are a little bit. What we mean is we have a greater proportion of the population who are old. And by old, we tend to mean over 30 or over 40, which is depressing for me because I am both over 30 and over 40. I won't tell you exactly how old. So as we get older, as I mentioned, we tend to have more chronic pain, more mobility issues, more psychological issues as well. I'm talking about dementia, of course. So here is the trends in dementia that we expect to see in Canada up to 2038. So the black line shows us the total trend, and the growth seems to be pretty steep. But look at the breakdown between men and women. There doesn't seem to be that much of a sex difference, which is interesting. But definitely, we anticipate that the burden of mental disability, especially among seniors, is going to increase substantially in the next few years. Now, globally, the factors can be different. The factors that are affecting disability rates. The first one that comes to mind is certain diseases emerge onto the landscape, and that leads to different types of disability. So HIV/AIDS, which is a global pandemic, especially in sub-Saharan Africa, results in a variety of disabilities, both for people experiencing full-blown AIDS and for people in late-stage HIV. Alcohol, tobacco, and drug use lead to all sorts of disability. If you're a chronic drinker, you're going to have dysfunction in a variety of organs, as well as psychological dysfunction. Tobacco abuse will lead to lung dysfunction, and drug abuse of all kinds leads to a variety of cognitive and physical dysfunctions. Globally, we're seeing an increase in lifespan, and as mentioned, as we get older, we have more issues around cognition and mobility. We also see issues globally around malnutrition, child labor, and child diseases, all of which are preventable So that's a big tragedy. And these lead to increases in child disability, entirely preventable disabilities. Quite sadly, armed conflict tends to be a profoundly important source of disability around the world, especially for children. So this stat is quite sobering. For every child killed in warfare, 3 are injured and acquire a permanent form of disability. And lastly, poverty can prevent a variety of minor impairments and injuries from progressing disability. Now, what I mean by that last statement is preventing poverty can prevent minor impairments from progressing. So poverty is the reason that these minor impairments tend to progress to disability. If you can't afford glasses for your visual impairment, you're going to be disabled. If you can't afford a cane to walk with, well, your limp may get worse. This chart shows us the distribution of global disability across ages in high-income and low-income countries. Interestingly, the slopes aren't that much different. So it shows that maybe in both the rich world and the poor world, the rates of disability increase at the same rates over age groups. However, in poor countries, there are universally higher rates. Note as well that women have higher rates of disability across all age groups, and we'll talk about that in a future lecture. I'll leave you with a couple of questions. What do you think is more problematic to lose, your vision or your hearing? It's not an easy or obvious question. I'm pretty sure most of you will instantly say, I don't want to lose my sight. If I have to choose one, I'd rather lose my hearing. And that's what most people would say. However, scientists would tell you that most cultures around the world find that hearing leads to the most suffering. The loss of hearing leads to the most suffering. Because if you lose your hearing, you're more likely to be unable to participate in social interaction. If you can't hear, you can't have a conversation. If you can't see, you can still have a conversation. Other aspects of your life are more difficult, of course. So always remember, there's a social context to all of this, and as social animals, our interactions with other people tend to be the thing that most clearly and proximately defines the quality of our lives. Unsurprisingly, this is why we have erupting in many parts of the world communities of hearing impaired people who form their own societies, because they can interact with each other more potently and more intensely than they can with hearing people. And who gets to decide if you're disabled or not? I mentioned that these definitions vary from culture to culture, and I said that if your impairment progresses to the point where you are unable to participate or to conduct an activity, we say that you're disabled. But who am I to tell you that you're disabled? Suddenly I've added a label to you. Don't you get to choose? These are all political questions, ethical questions, human questions, anthropological questions. I encourage you to give them some thought. That's all for now.